Hi, my name is Dr. Krista Bailey, and I'm here to talk to you today about sports medicine and rehabilitation therapy in veterinary medicine. I would like to thank The Ohio State University for the invitation to speak with you all today. I'm sorry I couldn't be there in person, but if you do like what you see and are interested in learning more, please reach out to me and let me know if there's any way I can help. Veterinary medicine to me is a passion, it's a lifestyle. I love helping animals and they can't speak for themselves. So it's very fun and interesting to kind of pick apart these cases and solve them like a mystery so that I can make their lives better and hopefully educate the owner so that their lives are also improved. I promised myself that I would never work a day in my life doing something that I did not love. And this is something that I'm passionate about. So even through those really challenging days when I feel like, I have nothing left, my love for animals is what keeps me going. I also really love the opportunities like this one, which allows me to give back to the community, encourage others, and to educate my own peers. How did I make it to this point? Well, I'll tell you, it really was not easy, okay? There is no clear-cut path to becoming what you are ultimately going to end up doing. I started off thinking, hey, I want to go and be a traditional doctor for humans, or maybe even a personal trainer. I thought about being a business owner, but nothing that I did up to this point kept me interested long enough to say, hey, I want to commit myself to doing this for the rest of my life. While I was going through this, though, there were challenging times. There are days where I'm taking an exam and I feel like, man, I don't know anything at all. And my exam is tomorrow morning at 7 a.m. and I stay up all night long cramming. But even in those small times, I find the victories or I find the silver lining. I surround myself with people who are positive, people who help to uplift me. And I always give myself that pat on the back. And I remember that, when I need to encourage myself, I don't look around to other people to build me up. I look within myself. I take that time to meditate. I take time to take care of myself and make sure that when I'm feeling down, I take a break and walk away because there's always going to be tomorrow, okay? One other thing that I didn't mention is the power of networking. We go through life, we meet people, and we think, hey, I may never see this person again. But then 10 years down the road, you do an interview for an internship and you run into that exact same person. So, not only is it important to keep those connections strong and reach out to those that you know and that you meet over time, but also avoid burning bridges because you never know when you're going to need to lean on someone. My path, like I mentioned, it was not very straightforward. So after high school, I graduated. I wasn't really ready to go to a four-year university where there was thousands of people in the class. So I chose to go to a smaller school, Potomac State College, where I had that individual care. It gave me some time to grow, some time to mature before I took the step onto West Virginia University. Now, West Virginia University had many, many, many different majors. And like I said, I didn't know exactly where I would end up, but that wide variety of options gave me the chance to kind of take a couple of classes, see what I was interested in, and then focus my energies towards what drew me in that direction. After I went to West Virginia University, I still wasn't 100% sure that I wanted to go to vet school. So I worked as a veterinary technician, and I also went to Howard Community College to take some additional classes to figure out, once again, what do I want to do? After a few years, I knew that veterinary school was where I wanted to be. And the only one that appealed to me, and there's many, many options out there, was Ross University. I chose that school because it had a hands-on approach and I really liked the idea of getting out of the country to explore new things. My last year of college, where I did my clinical year, was in London at the Royal Veterinary College. And both of those opportunities allowed me to travel, see the world. I went to Africa, I went to Guatemala, I went to, Mexico, I went to Honduras, Belize. I mean, so many different places. And the best thing about traveling is that you learn different techniques, because everyone does not do veterinary medicine the same way. Everyone has their own style. So it's really interesting and important to keep your mind open and flexible and try to pick up as much as you can from each of those people that you meet. Once I finished undergrad and veterinary school, I did not think I was going to do an internship, but I came back home and I wanted to get into something that I loved, and I interviewed at several general practice locations, and I actually stumbled upon the veterinary orthopedic and sports medicine group, which is right by my house. And when I walked in, I knew I knew it was for me. And from there, once I started with sports medicine, I knew that that was where I was going to stay. So I ended up doing my residency, and that's where I am now at the Veterinary Surgical Centers in Virginia. Once again, I traveled around the world. So this was me here at the Royal Veterinary College with some of my classmates. You know, we did everything from working with small animals and large animals. We didn't limit ourselves to just cats and dogs. We worked with even alpacas, you know, and pigeons and deer, foxes. I mean, there was just so many different opportunities, and I didn't want to say no to anything. So why did I end up with sports medicine and rehab? All through my life, I was an athlete. I did cheerleading competitively, dancing. I played soccer my first year in college, and then at West Virginia University, I became the first female competitive boxer. That passion for fitness kept trickling over, and so I became a gymnastics coach before I ended up going back to veterinary school. While I was in veterinary school, I was a personal trainer on the side, and I also, of course, worked with animals, but I wanted to keep both of those passions hand in hand and keep my skills sharp. After school, I worked as a disability aide for children in need, and that was my first introduction to things like orthotics and prosthetics, doing assisted feeding, and finding out what the needs of people who have disabilities are, and really getting an understanding of that. When I graduated from West Virginia University, I had this degree in animal nutrition. And I thought maybe I would just do nutrition, but it actually ended up kind of all working together. Um, Even my experience working at IKEA, you know, as a cashier, you know, learning how to talk to people, how to relate to people, and how to be of service to others is one of those invaluable tools that you need when you're a veterinarian and you're working with clients regularly. A typical day in the life of a resident, I see a lot of patients every day. First thing I do is I start from the top and I do a general overview and I figure out what do I need to do to help this patient. So sometimes that includes diagnostics like CT scans, MRIs, arthroscopy, and then I come up with a treatment plan once I have all my ducks in a row. And my treatment plan is extremely variable, and we mostly focus on conservative management options or what we're treating after they've gone to surgery and they need, you know, to get back to that place where they're functional, or they're at an athletic ability, they're an athlete, sorry, excuse me, they're an athlete and they need to get back to competition, or say they're a service animal and they need to get back to supporting their owner, or you know they're a police dog and they have to go back out in the field and work and take care of us, you know, keep us safe. So the most important part of my treatment plan is educating the owners, because if they're not on the same page as me, then my treatment plan may or may not be successful. And then not only education, but it's about the follow up. You know, when you're a vet, you have to be open to change. Every dog is different, every cat is different. So, a plan that I may instill with one patient may be effective and it may not be effective with another. So, I have to be very flexible and creative in finding out what's going to help my patients individually. With sports medicine and rehab, there's a wide range of things that we use in our toolbox, okay? So, like I said, we start off with diagnostics. We also use musculoskeletal ultrasound as a really helpful tool in actually imaging the muscles and tracking their progress over time, even. We do a lot of conservative management, so it doesn't matter if your pet just has osteoarthritis. Maybe they have a neurologic disorder like degenerative myelopathy or intervertebral disc disease. A lot of dogs have orthopedic issues directly, whether it be hip dysplasia or cruciate ligament tears, which is the ACL, referred to as the ACL in humans. And then, like I said, post-op cases, we do help to get them back to normal. We also do preliminary screening, so pen hip radiographs, OFA radiographs to see, do you have osteoarthritis or do you have the chance to develop this, and is there something that we can do now to try to help this dog. When it comes to our treatment plans, it's extremely variable. We have a lot of tools, so we can use Reiki, we can use our orthotics and prosthetics to support our dogs, chiropractic, acupuncture, just general conditioning, laser therapy, also known as photobiomodulation, shockwave therapy, therapeutic ultrasound, and low pulse magnetic field therapy are our mainstays that we use in our hospital. This is a photo of a couple of different dogs that are having, this is class 3B laser therapy, that's class 4 laser therapy. We use it to help reduce inflammation, to help to improve pain, for skin healing, for bone healing. There's so many different options as far as using laser therapy for treatment. Acupuncture here, we've got an electroacupuncture unit here, and this is our traditional acupuncture. And all these modalities, they work in a little bit of different ways, but they all are aiming to really improve comfort overall in our patients. Here we have some underwater treadmill and some land-based therapy. These are both tools that we use to help build strength, improve posture, proprioception, and both of these dogs are suffering from different conditions. So this dog is recovering from a hemilaminectomy, and we're working on really improving proprioception here and hind limb strength. Here, this is us doing spine surgery, neurosurgery on a dog, and this is an epidural that we're doing here. We do a lot of joint injections as well, and then sometimes we just take the joint fluid out for testing purposes, like arthrocentesis, if your dog maybe has like immune-mediated polyarthropathy or something like that. This is an example of pen hip radiographs, one of the views that we use to evaluate if they have hip dysplasia or arthritis. These are examples. This here is an orthotic that we would use to help support the tarsus. And this dog actually has had a pelvic limb amputation, and they're using a prosthesis. And we kind of watch how they're ambulating in them. We monitor their care while they're in it. There's a lot of things that you have to think about as far as their gait, any compensatory changes that happens to the rest of the body, and things like that. How do you get involved? If you're interested in something like this, don't limit yourself, okay? You're in high school now, so this is your time, to really take your future into your own hands. So volunteer, get interested in internships and externships, especially when you have summer breaks. Get a job that shows that you're consistent and dedicated. It doesn't even matter really what the job is. Like I said, even if you're doing a customer service job, this is something that shows dedication, that you're able to communicate with people effectively, and that you won't give up. Find a mentor, find someone who's willing to help you, point you in the right direction, because there's nothing better than someone who's already been there and been through that to help to kind of guide you along your journey. Stay true to yourself. I thought, am I weird? And sometimes we think that, because we love animals and everyone doesn't. And I dance and I'm silly and I laugh and, I'm always, the life of the party, so to speak. And, people have tried to change that about me, but I had to stay true to myself so that I can be the best me that I can be. And the most important part of this is just never give up. There are going to be times when you fall. There are going to be times when you struggle. There are going to be times when you fail a class, but it doesn't matter. It's all about the big picture. You need to keep pushing forward and never give up on yourself. And this is my contact information. If there's anything that I can do to help, please let me know. Please reach out. And otherwise, thank you so much for your time, and I hope that you guys conquer your dreams and accomplish all of your goals.